Hi, this is Dr. Jayshri Shah. I'm a consultant hepatologist and gastroenterologist. Today, on the occasion of World Hepatitis Day, I would like to share some information with you on viral hepatitis. Hepatitis simply means inflammation of the liver cells. Now, this can be due to different types of viruses. Hepatitis A and E is usually water or foodborne infection, and this usually causes a flu-like illness with nausea, vomiting, diarrhea, fever, joint aches, and it is self-resolving. Most people will recover in a span of couple of weeks. There is 1% chance of developing acute liver failure as a result of this infection. But the precautions to take to prevent this from happening are good hygiene, avoiding street foods, boiling your drinking water, and in patients who have never had hepatitis A before should get a hepatitis A vaccine. There is no vaccine available for hepatitis E. Now, hepatitis B and C, on the other hand, have been there endemic all over various parts of the world, but have been ever increasing in numbers in India. This is a blood-borne infection. It can be spread through blood products, through the sexual route. A mother can transfer the infection to her child. It can also spread among family members, people who are at risk of this infection, such as those on hemodialysis, those who have used tattooing, intravenous drug use, and have had previous blood transfusions, or have multiple sexual partners, should endeavor to get themselves checked for hepatitis B and C, because this is primarily a silent infection. By silent, I mean that it does not produce any symptoms. Most of the time, this stays in the blood and affects the liver cells over a period of 15 to 20 years and gradually progresses to the stage of cirrhosis. So initially, one may have just mild inflammation in the liver, which then goes on to cause scarring of the liver, which is called fibrosis. And when the fibrosis stage progresses over a period of years, it results in cirrhosis. Now, cirrhosis simply means a rock-hard liver. Your normal liver should be nice and soft. Why should one get scared from getting cirrhosis? Because obviously it is associated with several complications, and the dreaded complication is liver cancer. And besides, when the liver stops functioning because of cirrhosis, which means it decompensates, you can get jaundice, which means yellow eyes, you can vomit blood or pass blood in the stool, and you can get confusion of the brain with affection of the kidney function as well. So therefore, it is important to detect this infection early so that we can start the remedial measures and prevent the progression to cirrhosis and its complications. Now, besides the blood tests for hepatitis B and C detection, there are some other tests that can assist in assessing the damage done to the liver, to assess the degree of scarring. So the latest technology available is FibroScan, which is a non-invasive assessment of the degree of scarring of the liver. Now, the beauty about this test is it is quick, it can be done by the bedside, it is absolutely non-invasive, painless, and the results of these are available in just a few minutes. No patient preparation is required for this procedure. In the past, we were using liver biopsies to decide the amount of liver damage and stage the degree of fibrosis before commencing treatment. But FibroScan has completely replaced this technology, particularly in patients with fatty liver disease, hepatitis B, hepatitis C, and alcohol-related liver disease. So now that I have touched on the treatment, the big question is, can this be cured? Hepatitis B, we can suppress the infection, and in a good number of cases, with effective antiviral treatment, we can clear the virus. Although you see this normally happening in 10% with best medical treatment. On the other hand, if you have this infection and you leave it untreated, the chance of spontaneous resolution of this virus is very small. less than 1 in 100. As far as the treatment of hepatitis C, besides interferon, which was conventionally used as standard, and then there was progress towards pegylated interferon along with ribavirin, now in the market there are newer antiviral medication available, and drugs such as sofosbuvir, samipravir promise a 90% cure rate and ability to eradicate the hepatitis C virus, which has been tremendous progress done in this field over the last decade. So today, on World Hepatitis Day, I would suggest that all of you who identify yourself at being at risk of this infection, this silent infection, should go and get a simple blood test, the results of which are usually available very quickly, and should see a hepatologist if you are positive for this infection. On the other hand, if you are lucky and you are negative, then please ask your doctor to help you with the hepatitis B vaccine to protect you from this infection for life. However, please note that there is no vaccination available for hepatitis C. I thank you for all your attention.